Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And here at Gold, we are right in the middle of our Birth and Beyond online conference of 2020, a brand new conference that we have this year. And here with me is one of our speakers, Dr. Monika Mitra. Welcome.
Thank you. Great to be here.
It is lovely to have you here today. And before we talk a little bit about your presentation, tell us a little bit about yourself and your professional journey.
Sure. So my name is Monika Mitra, and I'm really honored to be here. I am a professor at Brandeis University, which is near Boston, and I'm also the director of the Lurie Institute for Disability Policy. I have been conducting research at the intersection of disability and public health for more than 20 years. And my focus within the larger area is on sexual and reproductive health of women with disabilities.
Wonderful. Thank you so much for sharing that with us here today. And I have to tell you, I'm so glad when I saw this presentation is coming up here and you're presenting this. I'm so happy and honored that you're presenting this with us, because I feel like as a midwife, women with disabilities are often forgotten or overlooked as a population, right? So even if I think of my own training, there isn't much information available. We didn't get to see much research, and especially then for the women, there isn't any pamphlets in the waiting room out there for them.
Mhm,
So,
mhm.
so tell us a little bit about um, this from your perspective.
Sure, and that's a very common reaction we get both from women's side but also from clinician side. Is it's an invisible population in a
Yeah.
way, or it's a forgotten population. And many years ago, I was actually writing a paper on sexual violence against women with disabilities around the time of pregnancy.
Mm,
And when I started looking at the literature on pregnancy, I found very, very little information on pregnancy in women with disabilities. And so that sort of got me intrigued and kind of interested in this area. And so from then on, I've been focused on this. There's a lot more literature, a lot more information now,
yeah.
but the lack of access, lack of information, both from the provider side, but also from the women's side is very, very apparent, even today.
Even today. So, but you've seen in your career, in your time researching this or working on this, you have seen and that there is now more available than it was maybe 20 years ago when you started this.
Absolutely. And I think one of the reasons is the National Institutes of Health in the United States, it
Mhm.
really has invested in this. They have a specific funding announcement on pregnancy in women with disabilities because they found this is an underserved population, a
Right.
marginalized population. So I have a few grants really focused on that. And then we've all been investigating this issue from different perspectives on
Mhm.
women who are deaf and hard of hearing, women with intellectual disabilities, women with physical disabilities, and as a result of which there's more literature, more information, and definitely more interest. But there is a ton more to do.
Yeah, absolutely. Do you see anything in the foreseeable future that there will be more, funding available? Are you already planning the next project, so to speak?
Yes, I'm always thinking of what needs to be done. I think one of the areas is I'm interested in is understanding the disparities at the intersection of racial ethnic minority populations and women with disabilities.
Yeah.
The other part that I'm very, very interested in is more kind of interventions and trainings. So we understand there are disparities, but now what are we going to do about it? And
Right.
I think this is the part where I'm really deeply interested in what kinds of trainings can we develop that could effectively help clinicians in providing quality prenatal care.
Absolutely. Yeah, there needs to be done more. I would, I would gladly take more trainings if that was available to me as well in my profession for sure. So I'm glad you're looking into that, and hopefully there will be more available. And then you have to come back and do a presentation on that one as well for us here at Code. Um,
Absolutely.
Now, with regards to your presentation, it's titled Disparities in Perinatal Care and Outcomes Among Women with Disabilities, an Urgent Call for Inclusion. Tell us a bit about what you will be talking on.
Sure. So the presentation I'm going to actually focus on what I would call a life force perspective. So I would start with the lack of, for example, sexual education that's focused on women with disabilities or children and girls with disabilities, and then going into disparities in contraceptive use.
Mhm.
And then going and then focus on the perinatal period, because the perinatal period doesn't happen in isolation, right? It's part of
Right.
our life force. And I think and so I and then I will I I'm going to present information both on quantitative research that we've done, where we've looked at large data sets, administrative data sets, survey data, and understanding and the different outcomes that women with disabilities versus women without disabilities face. And then I'm going to move on to our interviews that we've conducted, both with women with disabilities, but also clinicians, and
Mhm.
understanding what are the experiences, because obviously data is very important,
Right.
and but it doesn't tell the full story. And
Right.
so we wanted to dig deeper and understand it from the experiences of people who are both providing care, but also who are the care recipients.
Right.
And I'm going to describe some of those conversations that we've had.
Wonderful. I'm glad you're doing this because you're absolutely right. Data is important, but it doesn't tell the full story because we are people, right? It's the experience that also counts, and how we can combine the data that what we learn also with what people are experiencing and how we can make that better. Is there anything, especially when you're the interviews you're talking about there, when you talk to different people there, the providers and the families or women, that surprised you, that came up maybe again and again?
There are a number of things that have really surprised me, and I'm going to talk about two of them. One is the incredible sort of stigma and discrimination that women still receive to date. We're 2020, and the second part of it is I'm just surprised at the lack of accessibility in healthcare provider offices.
Yeah.
In from the American perspective, it's been 30 years since the Americans with Disabilities Act.
Yes.
Provider offices should have an accessible weighing scale, and they still don't. So the number of women, even with congenital disabilities, who have never been weighed,
Yeah.
and that was pretty, I would say, shocking rather than surprising.
Right. I can understand that. I can imagine that because even if I think of the places I've been to, either working or being a patient or client myself, there is often not much more as the ramp or maybe a bathroom that's equipped. But then what else is there?
Mhm.
As you mentioned, the scale. I haven't seen one in the offices I've been to lately. Or even other things that could be inclusive and be used and be helpful. And you're so right about that, and I think it has to do with, yes, of course, funds. It's expensive to upgrade and put these things into place, but also a lack of education, right? I mean, I think if providers or officers or even hospitals and staff there would know more about the topic and how the disparities, I think the interest would be there, and the
Mhm.
and kind of the power and the pressure would be there to kind of update and upgrade.
Absolutely. I think it's a lack of understanding in a way, or the lack of, sometimes it's not a lack of interest, it's just
Right.
a fundamental lack of understanding about inclusion. And I think that's sort of what's missing, and the need for training and education is critical in changing that.
Absolutely, absolutely. Before I let you go, Dr. Mitra, I have one question I have for you, and this is for our listeners here and our providers out there. We our conferences, we have doulas, we have nurses, we have practitioners and private practice. So, what do you say to our providers out there that are now saying, "Okay, I want to learn more. I want to do more." What is one simple step that they could get started on, or what they can start using in their practice right now?
Um, I, um, from our interviews, what I would say, the one thing is, first of all, to ask the women what they
Mm.
need.
Okay.
Too often women say the doctors never ask me what I need, and I know my own body. I've lived with my disability for a long time, or for my life. So I think asking the women, but also doing their own research. Too often doctors don't do that, clinicians don't do that, but doing a little bit of research on how to provide effective care.
Mm-hmm. Mm-hmm. Absolutely. Ask the women. That's such an important Such an important topic there. So often as providers or working in the field, we are out there giving information, right, and taking care of people. But often and this goes for all areas, right? We need to listen more and ask questions, especially with this population there as well.
Yes, absolutely.
Well, thank you so much, Dr. Mitra, for sitting down with me here and chatting about your topic here with us at Gold. It was a pleasure talking to you.
Thank you. You as well.
And for our viewers, if you have any questions, you can post them below. And we hope to see you at our Gold Birth and Beyond online conference of 2020. If you would like to find out more about this presentation and the other presentations in the conference, we invite you to go to goldbirthandbeyond.com. Thank you, everyone, for watching. Bye bye for now.
Bye.